Good day everyone, distinguished guests, ladies and gentlemen. I would like to greet everyone of this school day. Why don't we make this day not just wonderful, but also a day full of learning and new experiences? We've anticipated long enough for this day to come, but anticipation comes with painstaking efforts, sleepless nights, and wishful thoughts now come into reality. So what are we waiting for? The long wait is over. I welcome all of you to our seminar entitled COVID-19 Awareness Seminar. Now, may I request everyone to rise for our national anthem. Let us all feel the presence of our Almighty God as we offer Him a song of praise. Please take your seats. Again, I would like to welcome all of you to our seminar concerning COVID-19 awareness. Now, as your master of the ceremony, I would like to introduce myself first to you. I am Mr. Francis Kenneth Otom. It's so nice to see everyone in such a good mood today. Now, what would make your moves even better is to give you all the words and fuel your souls. Let us call on Miss Benji Ortega for our opening remarks.
Distinguished participants or beloved guest speakers, ladies and gentlemen, good morning. I am pleased to welcome you to our virtual seminar today on the awareness of COVID-19 virus. It aims at providing to everyone the knowledge of COVID-19 virus. In this virtual conference room, I recognize some familiar names of our participants from our government, from private sector, and also from major groups. I know you all have worked tirelessly and exert extra effort for the benefits of every Filipino citizen. COVID-19 brought us tragedy in our lives, and everyone is affected in this COVID-19 virus. Every day, the COVID-19 cases increases and several lives have lost. Every day we heard a news from the radio, and also we saw it in our television, motivates us to always practice the right health protocol to avoid the COVID-19 virus transmission. Every life is precious. People must exert caution and also extra effort to stop this COVID-19 pandemic and to the rest of the world. Today, we are very blessed to gather virtually to attend this COVID-19 awareness seminar. Parents, everyone and all, it is our obligation to teach and guide our younger children, the elders, and every members of our family to encourage them to stay home and to save their lives. Unity, solidarity, and self-discipline is the key to defeat this COVID-19 virus. We should spread love and not the virus. The most important in our difficult time is to continue monitoring the mental and physical health of our family members. This will help us to fight the COVID-19 virus. We should encourage to prepare healthy foods and nutritious diet and exercise. We should avoid drinking alcohol, stop smoking, to have a healthier body and longer life. COVID-19 is taking so much from us. But this COVID-19 pandemic teaches us a lesson to learn, to appreciate things, to spread love, to stay active and healthy physically and mentally, and to keep calm and carry on. Nothing in life is to be feared of, because God is always there for us to protect and guide us every day. We learn to understand, and now is the time to understand more, so that we may fear less. Thank you for having here today.
Thank you, Ms. Ortega. Now we are all geared up for our seminar today, but we would first like to recognize and acknowledge our speakers for today. Our first speaker for today is Ms. Lorraine Uwakan. Our second speaker is Ms. Larabel Hurak. And our third beautiful speaker is Ms. Julieta Oyanguri. For our seminar proper, may we call on for our first speaker, Lorraine Uwakan, Ms. Lorraine Uwakan, and let us give her a round of applause.
COVID-19 had brought many changes in our life. It changes almost all aspects of life. It affects the way we live, the way we feel, and the way we think. Is COVID-19 a big threat in your life? How can we surpass all the difficulties brought by this pandemic? Now, let us know and be aware about COVID-19. Please spare your time listening to the seminar entitled COVID-19 Awareness Seminar. Coronavirus disease, or also known as COVID-19, is an infectious disease caused by a newly discovered coronavirus. Coronavirus are a group of viruses that causes respiratory infections that are usually mild, including some cases of common cold. It was first identified in December 2019 in Wuhan, China. This group of viruses is named for club-shaped protein spikes that protrude from a viral surface and creates an appearance corona or crown when viewed via microscope. The global COVID-19 cases updates. As of the past days, the total cases of COVID-19 in the whole world reached 54,818,877, wherein 1,324,530 are deaths, while 38,140,906 were recovered, and there are 15,353,441 are active cases. The Philippines now has 407,838 confirmed COVID-19 cases after the Department of Health reported that 1,530 new cases on Sunday, November 15, 2020. The DOH reported 41 new deaths, bringing the death to 7,832, while the recoveries are up by 11,290, raising total recoveries to 374,329. Of the total cases, 25,677 are active. The risk factors of COVID-19. Conditions in which there is a strong evidence increased risks include chronic kidney disease, COPD, emphysema, people with lower immune health because of a solid organ transplant, obesity, those with a BMI or the body mass index greater than 30, serious heart conditions like heart failure and coronary artery disease, sickle cell disease, type 2 diabetes. The symptoms of COVID-19. Symptoms usually begin in 2 to 14 days after you come into contact with the virus. The common symptoms are fever, fatigue, dry cough, loss of appetite, body aches, and shortness of breath. Other symptoms include sore throat, headache, chills, loss of taste and smell, runny nose, nausea, vomiting, and diarrhea. These are the severe symptoms: constant pain in your chest, bluish lips or face, sudden confusion, troubled breathing, organ failure, and coma.
Thank you, Ms. Lorraine Owakan, for giving us the information about introduction, the risk factors, and the symptoms of COVID-19. And now, may we call on our second speaker, the beautiful Ms. Larabel Horak, and let us give her a round of applause.
Transmission. COVID-19 transmission occurs person to person through the following. First is droplets or aerosols. When an infected person coughs, sneezes, or talks, droplets or tiny particles called aerosols carry the virus into the air from their nose or mouth. Anyone who is within 6 feet of that person can breathe it into their lungs. Second type of transmission is airborne transmission. Research shows that the virus can live into the air for up to 3 hours. It can get into your lungs if someone who has it breathes out and you breathe that air in. Third is surface transmission. Another way to catch the new coronavirus is when you touch surfaces that someone who has the virus has coughed or sneezed on. Fourth is fecal-oral. Studies also suggest that virus particles can be found in infected people's poop, but experts aren't sure whether the infection can spread through contact with an infected person's stool. If that person uses the bathroom and doesn't wash their hands, they could infect things and people that they touched. Next topic is all about incubation period. On average, symptoms showed up in the newly infected person about 5 days after contact. Rarely, symptoms appeared as soon as 2 days after exposure. Most people with symptoms have them by day 12, and most of the other ill will seek by day 14. In rare case, symptoms can show up after 14 days. Researchers think this happened with about 1 out of 100 people. Some people may have the coronavirus and never show symptoms. Others may not know that they have it because their symptoms are very mild. Current studies might not include the mildest cases, and the incubation period could be different for this. People who get infected with can spread it to others 2 to 3 days before symptoms starts, and are most contagious 1 to 2 days before they feel sick. How long should I quarantine after I've exposed to coronavirus? If you might have come into contact with the virus and have no symptoms, you should self-monitor. Self-monitor means watching for signs such as fever, cough, and shortness of breath. Stay out of crowded places. Keep at least 6 feet away from other people. And wear a cloth face mask when you have to go out. If you traveled recently or know that you came into contact with someone who has COVID-19, you should self-quarantine. Stay home for 14 days. It's very rare for symptoms to show up after that much time. Check your temperature twice a day and watch for other symptoms. Stay away from other people, especially those who are at high risk of serious illness because of their age or another medical condition. Last topic is diagnosis. In order to confirm that you are positive of the coronavirus, then you should go with a diagnosed test. It includes PCR test, blood test, chest X-ray, and HRCT.
Thank you, Ms. Larber-Durak, for telling us the incubation period, transmission and diagnosis of COVID-19. And now, may we call on to our last speaker, the most beautiful Miss Julieta Oyangorin, and let us give her a round of applause.
Good day, everyone. I know that each one of us is still struggling about the existing COVID-19, which kills billions of people all over the world, even here in Philippines, as well as in our neighboring places, especially in our location. Yes, there is already vaccine discovered, but sad to say, it is not really we can assure yet, but there are prophylaxis that we can assure or we can help to spread out the virus. First, antiviral drugs. These are the drugs that are used to resist the SARS-CoV or COVID-19 transmission to close contact. Second, antibiotics. The famous antibiotics is azithromycin. It is effective in preventing pulmonary infections and patients' pneumonia, and it is anti-inflammatory effect on the airways. Next, vitamins supplements. Vitamin B complex, vitamin C, vitamin D, and zinc. And then next one is corticosteroids. It can be used only for short period of time, only 3 to 5 days. It shows progressive deterioration of oxygen saturation, and it is rapid worsening for features on chest imaging. It increases activation of pro-inflammatory response. And the next one is dexamethasone. It is effective for decreasing mortality in severe and critically ill cases. And the last one, the most effective and most proven, is plasma therapy from infected but recovered person to the newly infected person. It is injected into infected person's body to fight against the virus. That's all. So, here are the preventions and control the spread of the virus. First, use face covering, and when physical distancing is not clearly observed. Second, clean and disinfect frequently. Touch objects and surfaces. Third, perform hand hygiene. Fourth, rapid identification of suspected cases. Fifth, immediate isolation and referral for testing. Sixth, safe clinical management. And seventh, appropriate use of PPE. Here are the nursing interventions for us, or not only for us but also for others. First, assessing, history taking, and physical examination. When you say history taker, you should know on how to trace the history of that person, when and where he go, and to whom he will. And physical examination based on her figure and the physical appearance. And second, diagnosing impaired breathing pattern, anxiety, deficient knowledge about the existing virus. And third, planning to prevent the spread of virus to patients' family members, friends, close friends, and others. And fourth, monitoring vital signs, the temperature, the respiratory rate, and maintain oxygen saturation, as well as respiratory isolation, and enforce strict hand hygiene. Provide information related about that virus.
To all the speakers, thank you so much. We've learned a lot from you this day. Especially we couldn't have done this successfully without our participants and our speakers who spared their time attending the seminar. So let us move on to the awarding of certificates to our beautiful speakers, to Miss Lorena Wakhan, Miss Larabel Horak, and Miss Julieta Uyanguri. Thank you everyone for sharing this moment with us. And for our closing remarks, let us call Miss Megan Olan and hear it from here. A round of applause, please.
To our honorable guest speaker, Ms. Lorena Wakhan, Ms. Larabel Horak, and Ms. Julieta Uyanguri, to the faculty members, staff, students, good day. Indeed, this activity would not be successful without your presence. On behalf of seminar holders and facilitator, I would like to thank you all for taking part in our seminar entitled COVID-19 Awareness Seminar. COVID-19 is spreading in our community. Stay safe by taking some simple precautions such as physical distancing, wearing masks, keeping rooms well ventilated, avoiding crowds, cleaning your hands, and coughing on a bent elbow or tissue. Check local advice where you lived and worked. I hope that everyone has learned something from this seminar. Again, thank you very much, especially to our guest speaker for sharing their ideas regarding our topic. Let us be safe. Have a blessed day to everyone.
Thank you for such good words coming from you, Miss Megan Olan. I would like to thank all of us for being here. Again, thank you for coming to our seminar entitled COVID-19 Awareness Seminar. Enjoy the rest